Vermont Free CNA Practice Test with Answers 180 Questions Practice Test. Question 1. A nursing assistant is caring for an agitated client. What should the assistant do? Option A. Shout at the client to be quiet. Option B. Talk in a slow, calm, reassuring manner. Option C. Restrain the client immediately. Option D. Leave the client alone in the hallway. The correct answer is option B. Talk in a slow, calm, reassuring manner. Calm communication is the most effective way to de-escalate agitation in a resident. Question 2. What is the purpose for padding side rails on a client's bed? Option A. To make the bed look better. Option B. To keep the resident warm. Option C. To protect the client from injury. Option D. To store the resident's remote control. The correct answer is option C. To protect the client from injury. Padding prevents the resident from hitting their limbs against the hard metal rails. Question 3. Exercises that move each muscle and joint are called what? Option A. Weightlifting. Option B. Range of motion. Option C. Running. Option D. Yoga. The correct answer is option B. Range of motion. Range of motion exercises help prevent contractures and maintain joint health. Question 4. How can you best help a client who is not accepting a loss? Option A. Tell them to get over it. Option B. Encourage the client to talk. Option C. Ignore the client's feelings. Option D. Tell them you are too busy to listen. The correct answer is option B. Encourage the client to talk. Providing a supportive environment allows the resident to process their grief. Question 5. The Heimlich maneuver or abdominal thrusts are used for a client who has what? Option A. A broken leg. Option B. A blocked airway. Option C. A headache. Option D. A fever. The correct answer is option B. A blocked airway. This emergency procedure is used to dislodge an object from a person's windpipe. Question 6. To avoid pulling the catheter when turning a male client, the tube must be taped to which part of the body? Option A. The abdomen. Option B. The upper thigh. Option C. The foot. Option D. The bed rail. The correct answer is option B. The upper thigh. Securing the tube to the leg prevents painful pulling on the bladder and urethra. Question 7. The role of the ombudsman is to do what? Option A. Perform surgeries. Option B. Work with the nursing home to protect client rights. Option C. Cook meals for the residents. Option D. Clean the facility floors. The correct answer is option B. Work with the nursing home to protect client rights. The ombudsman is an independent advocate for residents in long-term care. Question 8. A nursing assistant who is active in her church is assigned to a client with no religious group. What should she do? Option A. Force the resident to join her church. Option B. Respect the client's beliefs and avoid starting religious discussions. Option C. Tell the resident they are going to hell. Option D. Avoid the resident entirely. The correct answer is option B. Respect the client's beliefs and avoid starting religious discussions. Professionalism requires respecting the resident's personal beliefs without judgment. Question 9. What should you do when a client's mail is delivered? Option A. Open and read it first. Option B. Give the client the unopened mail and offer help as needed. Option C. Throw the mail away. Option D. Leave it at the nurse's station. The correct answer is option B. Give the client the unopened mail and offer help as needed. Residents have a legal right to private, unopened mail. Question 10. Which of the following is a correct measurement of urinary output? Option A. 300 pounds. Option B. 300 degrees. Option C. 300 cubic centimeters. Option D. 300 inches. The correct answer is option C. 300 cubic centimeters. Cubic centimeters are equivalent to milliliters and are used to measure fluid volume. Question 11. A client offers you a $20 bill as a thank you. What should you do? Option A. take the money and buy lunch. Option B, politely refuse the money. Option C, tell the resident it is not enough. Option D, report the resident to the police. The correct answer is option B, politely refuse the money. Healthcare workers are not permitted to accept tips or gifts from residents. Question 12. If a client is sitting in their room masturbating, what should the nursing assistant do? Option A is shout at them to stop. Option B, leave the client alone and provide privacy. Option C, call their family and tell them. Option D, report them to the police. The correct answer is option B, leave the client alone and provide privacy. Residents have a right to sexual expression in their own private space. Question 13. To convert 4 ounces of juice to milliliters, what should you multiply 4 by? Option A, a 10. Option B, 20. Option C, a 30. Option D, 40. The correct answer is option C, 30. Multiplying by 30 is the standard conversion for ounces to milliliters. Question 14. What is the normal aging process best defined as? Option A, a time when you become much smarter. Option B, the time when normal body functions and senses decline. Option C, a time when you no longer need to eat. Option D, a time when you become a child again. The correct answer is option B, the time when normal body functions and senses decline. Aging involves a gradual decrease in the physiological reserve of the body's systems. Question 15. What is the process of restoring a disabled client to the highest level of functioning possible? Option A, retirement. Option B, rehabilitation. Option C, recession. Option D, reduction. The correct answer is option B, rehabilitation. Rehabilitation programs involve many different types of therapy to help a resident recover. Question 16. Clean bed linen placed in a client's room but not used should be handled how? Option A, put back on the clean linen cart. Option B, put in the dirty linen container. Option C, saved for the next week. Option D, given to another resident. The correct answer is option B, put in the dirty linen container. Once linen enters a resident's room, it is considered contaminated and cannot be used for anyone else. Question 17. Proper use of a waist restraint requires that the nursing assistant do what? Option A, tie it as tight as possible. Option B, watch for skin irritation. Option C, leave it on for 24 hours. Option D, tie it to the side rails. The correct answer is option B, watch for skin irritation. Frequent monitoring is required to prevent skin damage or strangulation from restraints. Question 18. How many tips does a quad cane base have? Option A, 1. Option B, 2. Option C, 3. Option D, 4. The correct answer is option D, 4. The 4 tips provide a wider base of support and more stability for the resident. Question 19. A safety device used to assist a dependent client from a bed to a chair is called what? Option A, a life jacket. Option B, a transfer or gait belt. Option C, a pair of handcuffs. Option D, a heavy rope. The correct answer is option B, a transfer or gait belt. The belt gives the assistant a secure grip to help the resident during the transfer. Question 20. If you need to wear a gown for a client in isolation, when must you take it off? Option A, at the nurse's station. Option B, before leaving the client's room. Option C, in the cafeteria. Option D, when you get home. The correct answer is option B, before leaving the client's room. Taking the gown off in the room prevents the spread of pathogens to the rest of the facility. Question 21. What is a beginning sign of a pressure sore? Option A, a deep hole in the skin. Option B, discoloration of the skin. Option C, a large bruise. Option D, clear skin. The correct answer is option B, discoloration of the skin. Redness or a change in color that does not go away is the first sign of tissue damage. Question 22. A sudden illness from which a person is expected to recover is called what? Option A. A chronic illness. Option B. An acute illness. Option C. A terminal illness. Option D. A permanent illness. The correct answer is option B. An acute illness. Acute illnesses have a rapid onset and a relatively short duration. Question 23. An ongoing illness that is slow or gradual in onset and has no known cure is called what? Option A. An acute illness. Option B. A terminal illness. Option C. A chronic illness. Option D. A short-term illness. The correct answer is option C. A chronic illness. Chronic illnesses like heart disease or diabetes require long-term management. Question 24. Which member of the nursing team is responsible for the entire nursing staff? Option A. The certified nursing assistant. Option B. The licensed practical nurse. Option C. The director of nursing. Option D. The medical doctor. The correct answer is option C. The director of nursing. The director of nursing is the highest ranking administrative nurse in the facility. Question 25. What is the term for an unexpected event that causes harm to a resident? Option A. An incident. Option B. A routine. Option C. An assessment. Option D. A policy. The correct answer is option A. An incident. Incidents must be documented and investigated to improve facility safety. Question 26. Which of the following describes a resident who is aware of self, place, and time? Option A. Alert and oriented times 0. Option B. Alert and oriented times 1. Option C. Alert and oriented times 2. Option D. Alert and oriented times 3. The correct answer is option D. Alert and oriented times 3. Orientation to person, place, and time is a standard measure of cognitive function. Question 27. What is the term for a federal health insurance program for people aged 65 or older? Option A. Medicaid. Option B. Medicare. Option C. HMO. Option D. PPO. The correct answer is option B. Medicare. Medicare is the primary insurance provider for the elderly in the United States. Question 28. A person who helps residents voice grievances and protects their rights is called what? Option A. A doctor. Option B. A lawyer. Option C. An ombudsman. Option D. A physical therapist. The correct answer is option C. An ombudsman. The ombudsman acts as an independent advocate for individuals in long-term care. Question 29. Negligence by a professional person, such as a doctor or nurse, is called what? Option A. Malpractice. Option B. Slander. Option C. Libel. Option D. Battery. The correct answer is option A. Malpractice. Malpractice is a specific type of negligence related to professional standards of care. Question 30. Making false statements orally that damage a person's reputation is called what? Option A. Libel. Option B. Slander. Option C. Assault. Option D. Neglect. The correct answer is option B. Slander. Slander is the verbal form of defamation of character. Question 31. Unlawful restraint or restriction of a person's freedom of movement is called what? Option A. Battery. Option B. Assault. Option C. False imprisonment. Option D. Fraud. The correct answer is option C. False imprisonment. Using restraints without proper authorization or medical need is a form of false imprisonment. Question 32. Touching a person's body without his or her consent is called what? Option A. Assault. Option B. Battery. Option C. Neglect. Option D. Ethics. The correct answer is option B. Battery. Battery involves physical contact that is non-consensual or harmful. Question 33. Considering the whole person, including physical, social, psychological, and spiritual needs, is called what? Option A, holism. Option B, apathy. Option C, bariatrics. Option D, homeostasis. The correct answer is option A, holism. Holistic care addresses all aspects of a person's well-being, not just their physical illness. Question 34. A person who is unable to respond to stimuli is described as what? Option A, alert. Option B, confused. Option C, comatose. Option D, paranoid. The correct answer is option C, comatose. A coma is a state of deep unconsciousness where the person cannot be awakened. Question 35. The characteristics of a group of people, such as language, values, and habits, is called what? Option A, ethics. Option B, holism. Option C, culture. Option D, religion. The correct answer is option C, culture. Culture influences how a person views health, illness, and healthcare providers. Question 36. In Maslow's hierarchy of needs, which needs must be met first? Option A, self-esteem. Option B, love and belonging. Option C, safety and security. Option D, physical or physiological needs. The correct answer is option D, physical or physiological needs. Basic needs like air, water, and food are the foundation of human survival. Question 37. Restating the person's message in your own words to ensure understanding is called what? Option A, clarifying. Option B, focusing. Option C, paraphrasing. Option D, open-ended questioning. The correct answer is option C, paraphrasing. Paraphrasing helps verify that the nursing assistant has interpreted the resident correctly.